I believe every client has told me that they had diabetes related questions, right? So you can count on that. Millions of people have diagnosis, and we need to be able to not only understand the medications that are used to treat them, be able to apply that knowledge, and also to do patient education, right? That's through application. So a male client has been diagnosed with type 1 diabetes. When teaching the client and family how diet and exercise affect insulin requirements, Nurse Joy should include which guidelines. So as always, I encourage you to have something to write with, something to write on. To paraphrase, what exactly is this question asking me? And often it's dealing with relationships. And we're looking at this question and we have some relationships here. So go ahead and paraphrase it. What relationships do you think are in here? Let's look at the answer selections. A, you'll need more insulin when you exercise or increase your food intake. Or B, you'll need less insulin when you exercise or reduce your food intake. Or C, you'll need less insulin when you increase your food intake. Or D, you'll need more insulin when you exercise or decrease your food intake. So go ahead and select your answer, pause it, and pause to select your answer, then come back. So we're looking at this question. We have to know something about type 1 diabetes. We do have a diagnosis in here. And what is specifically is looking at the relationship between that, diet and exercise, and insulin requirements. So those are like your keywords. What do you tell someone who has type 1 diabetes about diet and exercise and insulin requirements, right? And so this is a patient teaching. What are we looking for? A correct answer. So if we look at A, you'll need, and I don't do the tricks. I don't go from back to top. I just read them as it is. Take it as it is, surrender to the test, and read it as it is. So you'll need more insulin when you exercise or increase your food intake. So do know that when you exercise, that when you exercise, that actually has a way of decreasing the amount of insulin that you need because your cells are more apt to bringing in the insulin. B, you'll need less insulin when you exercise or reduce your food intake. That is true because when you exercise, again, your body is more receptive to the insulin and helping getting the sugars into the cells. And then, of course, if you're reducing your food intake, you need less insulin because you run the risk of hypoglycemia. You'll need less insulin when you increase your food intake. You'll need more insulin when you increase your food intake because it's more sugar that's involved. You'll need more insulin when you exercise or decrease your food intake. That's false because we already said when you decrease your food intake that you need less insulin, right? So the answer is, if you guessed it, is actually B. I can tell this is a Nurse Labs question because of the rationales here. But as you can see, the more sugar you have, the more insulin you need. When you start exercising, that helps. And as you can see, if you look at the rationale, there's more information in here that can help you to close up the knowledge and application gaps. All right, you guys, take care. Remember, read your questions thoroughly. It's not about running to see how many questions you can do to increase your chances of passing, but maximizing every question is what actually increases your chance of passing. You take your time, you read it, you see what they're asking you, and then you act on that information, your knowledge and your critical thinking. Talk to you guys soon.